So by this time, all of us know that this mucormycosis is an opportunistic infection which is caused by a group of fungus, Mucormycetes. And these fungi, they are ubiquitous in the environment, that is, they are present everywhere, but they preferentially live in damp environment where there is low sunlight on the dead and decaying matter or manure, etc. So these fungi, they release spores which are easily aerosolized and dispersed into the environment. So what happens when these spores of the fungi enter into the nose, when they enter inside our nose? When the spores of this mucor fungus, they are inhaled, they enter the nasal cavity and they just get lodged on the flesh or the turbinates, what we call, inside the nasal cavity. In normal individuals, these spores are immediately being washed off by the normal mucociliary mechanism which we have inside our nasal cavity, or they are just phagocytized by the macrophages which are produced by our immune system. But in the immunocompromised individuals, like the people who are suffering with COVID or who have been recovered recently from COVID, or people like uncontrolled diabetes, uncontrolled sugar levels, or people who are on long-term steroid medications or some immunomodulator drugs, or people who have recently undergone some solid organ transplant like liver or renal transplants, or HIV patients, or people who are suffering with the hematological malignancies who have been taken medications for a pretty long time. In all these people, the immune system or the capacity to fight back against this mucor will not be so much. So this mucor, it starts as an opportunistic infection. And now, because there is adequate amount of sugars and good acidotic environment which is created inside the nasal cavity, this mucor enters into the blood vessels. And when it enters into the blood vessel, it cuts off the blood supply to the structures which are supplied by it. And after invading the blood vessels, as I told you, they rapidly spreads into the sinuses. It could be maxillary, ethmoidal, and the frontal sinuses, as I depicted there. And finally, the skin and the soft tissues which are surrounding them are entirely being necrosed. And finally, there is a bit of lag. And because of the lack of blood supply, as the mucor cuts off the blood supply, all the structures which are supplied by these blood vessels, they start dying and they get necrosed, leading to a black gangrene-like situation. And hence the name turned out to be black fungus. It is actually not called black fungus. It's because of the clinical presentation, it appears like black eschar or black gangrene. This mucormycosis is given the name black fungus. So what are the symptoms that we need to watch for? In fact, what are the early symptoms that we need to watch for in case of mucormycosis? Early symptoms of mucormycosis are just similar to the symptoms of sinusitis, which are like people complain of normal nasal block or congestion along with some nasal discharge. And this nasal discharge could be blood-stained discharge, or it could be blackish discharge, or some may just have black dried crusts which are discharging from the nose. And most of the people do have a one-sided facial pain. And this is really important thing because it's not like a vague facial pain people get panicked about. The pain is so much that even if you take some pain medication, it doesn't go off. Even when you're sleeping, that pain still persists. So that's the kind of facial pain we ask you to watch out for. And some may have swelling on one side of the face. And this is because of the spread of the fungus and also surrounding zone of inflammation around the invading fungus. And that's the reason they have facial swelling. And some may complain of numbness over the cheek. And the reason why they have numbness is when this mucor, it starts invading the nerves, the infraorbital nerves. So they tend to have paresthesias or numbness or altered sensations. So that needs to be checked for. And Some people may have toothache or loosening of tooth when the palate or the upper jawbone is being involved. And some may also complain of deep seated pain or blurring of vision or double vision. This is really important to watch out for, because right now, in the early situations, people are just coming with a deep seated retroorbital pain, and this when the orbital apex, the apex of your orbit, is being involved. And whenever you experience such symptoms, immediately rush to an ENT surgeon or to an ophthalmologist, because the next thing what you land upon is sudden loss of vision. So that needs to be really checked for. And finally, you may land up with black skin lesions, which I have shown you earlier. It's when the soft tissues and the skin overlying is being necrosed by the fungus. It's a gangrenous situation, what we look out. So these are the symptoms what everyone should watch out for.